Lateral epicondylitis is an inflammatory response secondary to overuse. It can be commonly identified by pain and/or weakness on the outside of the elbow. You have two common points on the elbow, which are your medial and your lateral epicondyles. Those are the attachment points for a lot of the muscles that are in your forearm. When you're looking at the lateral epicondyle, we're looking at all the extensor tendons that extend the wrist or open the hand. These muscles all primarily attach back at this lateral epicondyle. The most common mechanisms that we see for a lateral epicondylitis are all secondary to overuse. Whether you are using a hammer or a screwdriver or a drill, or you're doing frequent grasping, lifting, those are all things that can contribute to an inflammatory response. What happens is that muscle gets overworked, and when that muscle gets overworked, it breaks down and it's more susceptible to injury. Some of the best treatment techniques are rest, ice, compression, gentle stretching, and then gentle strengthening. Rest is one of the most important things. We want to give that muscle time to repair. Ice is going to help with controlling inflammation. Gentle stretching is going to help move that muscle without causing too much stress on it. We want to make sure that when you have an injured muscle, that you want to stretch gently. If you stretch aggressively, again, you can overstress that muscle that's trying to heal itself. Once we have good control of pain symptoms, especially at rest, we will gently start to introduce some strengthening exercises. If you look in the maintenance home exercise portion on the website, there are videos that will walk you through stretching exercises for the wrist and elbow, and also strengthening exercises for the elbow. If you are having issues, if you're having pain, soreness in the elbow, feel free to reach out to me. You can send me a message, you can send me a video chat, and we can identify some of the factors that have led up to that and also give you some solutions to control the pain symptoms. Hope you all have a nice day and stay safe on the job site.